Before you put another shampoo, spray, oil, or leftover medication on your dog's skin, stop and look at where the itching is happening. The location of the itch can be your first major clue. A dog chewing the base of the tail may be telling a very different story from a dog licking only one paw. Red ears, a musty belly, tiny crusts along the back, or itching that appears every spring can each point us in a different direction. And here is the mistake I see pet parents make most often: treating the scratching as if the scratching itself were the disease. It is not. Itching is a symptom. Fleas, mites, allergies, infection, irritation, and even pain can all create similar behavior. Some dogs have two or three of these problems at the same time. That is why the strongest product is not always the fastest path to relief. The correct diagnosis is. I'm Dr. Ivy, a licensed veterinarian. In this video, I'll walk you through 7 common reasons dogs scratch, lick, chew, rub, or scoot. I'll show you the body patterns that matter, the clues you can check safely at home, the mistakes that can make the skin worse, and the signs that mean your dog should be seen quickly. This is general veterinary education, not a diagnosis for your individual dog. And before we start, one urgent warning. If your dog suddenly develops facial swelling, widespread hives, difficulty breathing, repeated vomiting, weakness, or collapse, seek emergency veterinary care immediately. That can be a serious allergic reaction. For other cases, take 10 seconds and think like a detective. Is the itch strongest at the tail base, paws, ears, belly, face, or one exact spot? Is it seasonal or year-round? Did it begin after grooming, boarding, a food change, a new medication, a walk on treated grass, or a missed parasite dose? Are other pets or people in the home itchy? Those details can save weeks of guessing. The first cause is fleas and flea allergy dermatitis. Many owners say, "I checked. I did not see a single flea." But not seeing fleas does not rule them out. Fleas are quick, they hide deep in the coat, and dogs often swallow them while grooming. A dog that is allergic to flea saliva may react intensely to only a few bites. The classic clue is itching, chewing, hair loss, or small crusts over the lower back, rump, base of the tail, and backs of the thighs. Some dogs also develop red skin on the belly or groin. When the worst itching is concentrated near the tail base, fleas should remain high on your suspect list, even if you never see one. Look for flea dirt, which resembles dark pepper flakes. Comb the coat over a white surface, especially near the tail base. Place any black specks on a damp white paper towel. If they dissolve into reddish-brown smears, they may contain digested blood. That is a useful clue, but a clean flea comb still does not completely exclude fleas. Remember that fleas do not live only on the dog. Eggs and immature stages may remain in bedding, carpets, furniture, and outdoor spaces. That is why one treatment on one pet may not solve the household problem. Consistent prevention for every pet, vacuuming, laundering bedding, and following the environmental plan recommended by your team may be necessary to break the life cycle. Do not combine flea products randomly. Never use a dog-only product on a cat, and do not assume that natural means harmless. Concentrated essential oils and homemade pesticide mixtures can irritate skin or poison pets. The best flea and tick product depends on your dog's age, weight, medical history, lifestyle, and location. Tell your veterinarian about any history of tremors, seizures, or neurologic disease before choosing certain parasite medications. Because number 2 is mites and other external parasites. This is where the naked eye can mislead you. Many mites are microscopic, so you may see the damage without ever seeing the cause. Sarcoptic mange, commonly called scabies, can create sudden and severe itching. Dogs may develop redness, crusting, and hair loss around the ear edges, elbows, hocks, chest, and belly. The itch may be so intense that the dog cannot sleep or scratches until the skin bleeds. Scabies can spread between dogs. People in close contact may develop temporary itchy bumps, although the canine mite usually does not live permanently on humans. Tell your veterinarian if the itching began after a shelter stay, boarding, grooming, daycare, contact with wildlife, or time around unfamiliar dogs. Also mention if another pet or a person in the home has become itchy. Lice, ticks, and other parasites can also irritate the skin. A veterinarian may use a flea comb, skin scraping, hair examination, tape preparation, or other testing. One negative scraping does not eliminate every mite in every case, so the pattern, exposure history, and response to treatment still matter. Please never put bleach, kerosene, motor oil, household insecticide, or concentrated disinfectant on a dog. These dangerous home remedies can cause chemical burns, organ injury, breathing problems, or poisoning. Parasites are treatable, but the product and dose must be appropriate for the species and the individual pet. Because number three is environmental allergy, often called canine atopic dermatitis. This is one of the most common reasons dogs develop chronic or recurring itch. Dogs may react to pollens, grasses, molds, dust mites, and other environmental allergens. But unlike many people, allergic dogs often show their problem through the skin rather than through sneezing. The body pattern is important. Environmental allergy commonly affects the paws, face, ears, armpits, belly, groin, and skin folds. You may notice paw licking after walks, face rubbing against furniture, repeated head shaking, or ears that seem to become infected again and again. In some dogs, recurrent ear trouble is the first or only obvious sign. Timing gives another clue. A dog that flares every spring or fall may be reacting to seasonal allergens. A dog that itches all year may be reacting to indoor allergens, food, ongoing parasites, infection, or a combination. Some dogs itch year-round but become much worse during one season. Atopic dermatitis is often managed rather than permanently cured. That may sound discouraging, but good long-term control is possible for many dogs. The plan may include parasite prevention, treatment of secondary infection, bathing or topical therapy, prescription itch control, skin barrier support, trigger reduction, and sometimes immunotherapy. The right combination varies from dog to dog. At home, you may be able to reduce some exposure by wiping or rinsing paws after outdoor activity, washing bedding regularly, and following a veterinarian-approved bathing plan. Use lukewarm water. Hot water can make inflamed skin feel worse. Avoid harsh human shampoo, heavily fragranced products, and repeated degreasing baths unless your veterinarian has recommended a specific product for your dog's condition. Now pay close attention because the fourth cause is often blamed too quickly: food allergy. Food allergy is real, but every itchy dog is not allergic to food, and every food allergy is not caused by grain. Dogs can react to dietary proteins or other ingredients they have eaten before. The signs can look almost identical to environmental allergy. Possible clues include year-round itching, repeated ear infections, paw licking, face rubbing, or irritation around the belly and rear end. Some dogs also have soft stool, vomiting, excess gas, or frequent bowel movements. Others have only skin and ear signs. Changing from one store-bought food to another every few weeks does not reliably test for food allergy. Neither does a mail-order saliva or hair test. The dependable method is a strict elimination diet trial followed, when appropriate, by a controlled food challenge. A veterinarian may recommend a therapeutic hydrolyzed diet or a carefully selected novel protein diet for a defined period. Depending on the case, diet trials commonly continue for several weeks and may extend up to about 12 weeks. During that trial, every bite matters. Flavored medications, dental chews, table scraps, training treats, supplements, pill pockets, and food stolen from another pet's bowl can invalidate the result. This is why a food trial is not simply trying a new food. It is a controlled diagnostic test. A diet trial works only when it is strict. Guessing, rotating foods, or removing random ingredients can create confusion without giving you a reliable answer. Cause number 5 is the one that can trap a dog in a painful cycle: bacterial or yeast infection. Sometimes infection begins the problem. More commonly, it appears after allergies, parasites, moisture, skin fold friction, or repeated scratching weaken the skin barrier. Bacterial skin infection may cause red bumps, pimple-like lesions, circular areas of scale, crusts, scabs, hair loss, tenderness, or draining sores. Yeast overgrowth often causes redness, greasy skin, thickening, dark discoloration, and a strong, musty odor. The paws, ears, armpits, groin, neck, belly, and skin folds are common trouble spots. The smell is a clue, but it is not a diagnosis. Different skin problems can look and smell similar. Here is how the cycle develops. The original trigger causes itching. The dog scratches, licks, and chews. That damages the skin barrier. Bacteria or yeast multiply more easily. The infection creates even more inflammation and itch. Soon the dog is scratching because of both the original problem and the secondary infection. That explains why an allergy medication may seem to help only a little when an active infection is still present. It also explains why treating the infection may improve the dog dramatically Yet the itching returns later if the underlying allergy, parasite exposure, or skin fold problem has not been controlled. Veterinarians often use skin cytology, collecting cells with tape, a swab, or a glass slide and examining them under a microscope. This can reveal bacteria, yeast, and inflammatory cells within minutes. Recurrent, deep, or difficult bacterial infections may require culture and susceptibility testing. Do not use leftover antibiotics, steroid creams, or random antifungal products. The wrong treatment can delay diagnosis, worsen certain infections, contribute to antimicrobial resistance, or be unsafe when licked. If the skin smells strongly, oozes, bleeds, spreads rapidly, or feels painful, your dog should be examined promptly. Because number 6 is contact irritation or damage to the skin barrier. Sometimes the trigger is not inside your dog, it is something touching the skin. Possible irritants include grooming products, shampoos, sprays, topical medications, floor cleaners, carpet treatments, laundry products, lawn chemicals, pool water, rough fabrics, plastic materials, and a new collar or harness. Reactions often appear on areas with direct exposure or thinner hair, such as the feet, belly, chin, armpits, groin, or neck. The timeline can reveal the answer. Did the itching start within hours or days of grooming? After sleeping on freshly washed bedding? After walking on a recently treated lawn? After a topical flea product? Is the redness shaped like the collar, harness, bandage, or clothing that touched the skin? Does the dog improve when away from one environment? If you suspect a recent surface exposure and your dog is otherwise stable, prevent licking and gently rinse the fur and skin with plenty of lukewarm water. If a chemical may be involved, contact your veterinarian or an appropriate pet poison resource, and keep the container or photograph the ingredient label. Do not apply vinegar, alcohol, hydrogen peroxide, essential oils, or strong disinfectants to raw, inflamed skin unless a veterinarian has prescribed a specific veterinary formulation. Something that kills germs in a kitchen may damage living tissue and increase discomfort. And now, the seventh cause, the one many owners do not expect. The behavior may look like itching even when the main problem is pain, a foreign object, or another non allergic condition. A dog licking only one paw may have a torn nail, a splinter, a grass on, an interdigital lesion, a small cut, or pain higher in the leg. A dog repeatedly licking one joint may be reacting to arthritis or a soft tissue injury. A dog scratching one ear may have infection, a foreign body, a growth, or painful inflammation. Scooting and licking under the tail may be related to anal sac disease, parasites, stool contamination, or local irritation. Look for asymmetry. Allergies often affect multiple areas, although they can begin subtly. Pain and foreign objects are more likely to make a dog focus on one exact spot. Check between the toes, around the nails, beneath the collar, and under long hair, but do not dig into painful tissue or pull on an embedded object that could break. Neurologic sensations can occasionally cause biting, skin twitching, or sudden attention to one area. Compulsive licking can also develop with anxiety, frustration, or stress, but behavior should not be blamed until medical causes have been investigated. A dog may also begin licking because of pain or allergy and continue the habit after the original trigger improves, so physical and behavioral factors can overlap. If your dog suddenly fixates on one spot, limps, cries when touched, holds the head tilted, has ear discharge, develops swelling, or cannot settle, arrange an examination. Allergy shampoo will not remove a grass on, repair a torn nail, or treat a painful ear. At this point, you may be wondering what you can safely do tonight. First, stop the self-trauma. If your dog is chewing the skin open, use a properly fitted recovery collar or protective garment while arranging care. Make sure it does not restrict breathing, drinking, or movement, and check that it is not rubbing the affected area or trapping moisture. Second, examine your dog in bright light. Check the ears, paws, nail beds, belly, armpits, groin, skin folds, tail base, and the area under the collar. Look for flea dirt, ticks, redness, odor, crusts, moisture, swelling, discharge, broken nails, and tender spots. Do not scrub, squeeze, or repeatedly pick at the skin. Third, document what you see before bathing. Take clear photographs and a short video of the scratching or licking. Record where it happens, how often it interrupts sleep, and whether it follows walks, meals, medication, or time in a particular room. A simple itch score from 0 to 10 can help you track change. Fourth, review parasite prevention. Write down the exact product, dose, and date it was given. Check whether every pet in the home is protected. Bring the package or a photograph of the label to your veterinary visit. Fifth, simplify. Stop adding new shampoos, treats, oils, supplements, and home remedies. When five things change at once, no one can tell what helped or what caused a reaction. Sixth, call your veterinarian when itching persists, returns repeatedly, interrupts sleep, causes hair loss, or damages the skin. A practical skin workup may include a detailed history, full physical and ear examination, flea combing, cytology, skin scraping, and additional testing based on the findings. These basic steps are often more useful than guessing from a photograph alone. Seek prompt veterinary care for open sores, pus, rapidly spreading redness, a strong odor, significant pain, lethargy, reduced appetite, repeated head shaking, ear swelling, or extensive hair loss. Puppies, senior dogs, and dogs with other medical conditions may need earlier evaluation. There are also four common mistakes I want you to avoid. Do not give human pain relievers such as ibuprofen or naproxen. These can cause life-threatening poisoning in dogs. Acetaminophen can also be dangerous unless a veterinarian has specifically prescribed and calculated it for that patient. Do not start a human antihistamine without checking the exact product and dose with your veterinarian. Combination products may contain decongestants or other unsafe ingredients, and antihistamines do not adequately control many causes of canine itch. Do not use a medication left over from another pet or another episode. Similar looking rashes can have completely different causes, and steroids can worsen or hide certain infections. And do not assume that temporary relief proves the diagnosis. An anti-itch medication may reduce scratching from several different conditions, while the underlying flea exposure, infection, food reaction, or painful lesion still needs specific treatment. A veterinarian will usually examine the whole dog, not only the spot that caught your attention. The ears, paws, claws, skin folds, abdomen, groin, and tail area often reveal the pattern. Testing may identify parasites or infection quickly. Then the plan can address immediate comfort while working systematically through the underlying causes. That word, systematically, matters. A dog can have fleas and environmental allergy. A dog with food allergy can develop yeast infection. A dog with atopic dermatitis can also tear a nail and lick one paw more than the others. When several problems overlap, relief may come in layers. Treating one layer can reveal the next. So remember the map: tail base and lower back. Think about fleas, ear edges, elbows, and severe contagious itch. Consider mites, paws, face, ears, armpits, and seasonal flares. Environmental allergy moves higher on the list. Year-round itch with recurring ears or digestive signs. A properly controlled food trial may be needed. Odor, grease, pimples, crusts, or oozing. Look for bacterial or yeast infection. A reaction after grooming, cleaning, lawn exposure, or a new collar. Consider contact irritation. One exact painful spot. Do not forget nails, foreign objects, joints, ears, and other non-allergic causes. These patterns are clues, not final diagnoses, but they can help you ask better questions and avoid random treatment. Your dog does not need a cabinet full of products. Your dog needs you to notice the pattern, prevent further injury, and get the right help before a small itch becomes a painful itch scratch cycle. If this video helped you understand what your dog's scratching may be telling you, share it with another dog parent. Subscribe for calm, veterinarian-led guidance that helps you recognize problems earlier and make safer decisions for your pet. And tell me in the comments, where does your dog itch the most? The paws, ears, belly, or base of the tail? That one detail may be the first clue in solving the mystery.